Welcome back to the deep dive. Have you ever really stopped to think about the secrets the human body still holds even after someone passes away?
It's quite profound when you consider it.
It really is. But there's actually a specific, very rigorous medical procedure designed to uncover those secrets, to tell us stories long after life ends.
Exactly. And for this deep dive, we've looked into a lot of source material about that very procedure, the autopsy. It's often kind of misunderstood, maybe thanks to TV and movies, but its actual importance,
Yeah.
immense
Mm,
for medicine, law, even public health.
yeah.
So our mission today is to sort of pull back the curtain.
Mm.
We want to take you through its surprisingly long history, why it's done, the different kinds, and what actually happens during one.
And it's interesting, right from the name, it almost speaks for itself. It's called an autopsy, a post-mortem examination, sometimes necropsy. But that core idea, it comes from Greek, meaning to see for oneself.
That's a perfect starting point. Because fundamentally, an autopsy is a surgical procedure. It involves a really thorough examination, including dissection, of a body after death.
Clearly by a pathologist, right?
Yeah.
A specialist doctor.
That's right, a pathologist. And the main goals are typically to figure out the cause, the mode, and the manner of death. Or sometimes it's more about evaluating a disease or injury for, say, research or teaching purposes.
And that phrase, to see for oneself, it's baked right into the word autopsy, from ancient Greek autopsia. Autos, meaning oneself, and opsis, meaning sight or view. Been used medically since, the 17th century?
Precisely. And then you have post-mortem, which is Latin, post for after, mortem for death. That one pops up around 1734.
Okay.
And then there's necropsy, also Greek roots, nekros meaning dead, and opsis again, sight. Now the key difference here, and most listeners probably know this, is that necropsy is usually for animals.
Ah,
Right.
while autopsy is the term we use for humans. Got it. So, okay, we know what it is, but the big question is why? Why does it matter so much? What's the real point beyond just confirming someone has died?
That's where it gets really fascinating. The aims are, well, they're quite varied. Number one is pinpointing the cause, mode, and manner of death.
Cause being the specific disease or injury, mode like heart failure or respiratory arrest, and manner like natural, accident, suicide, homicide.
Exactly. But it goes deeper. It's also about assessing the person's overall health before they died. And crucially, evaluating the medical care they received. Was the diagnosis right? Was the treatment appropriate?
That leads to two main paths, doesn't it? Legal autopsies versus medical or academic ones.
Correct. The legal ones are often mandated, say in criminal cases, or to determine if a death was natural or unnatural, find the source of an injury, maybe estimate time of death.
While the medical or academic ones are more focused on understanding the disease process, maybe for research or as teaching tools for medical students.
And this is where our sources show something quite striking, how often autopsies reveal things that were missed when the person was alive. One systematic review found that a major diagnostic error is found in about 25% of autopsies.
25%, 1 in 4, that's huge.
It is. Now, that rate has come down over time, with better imaging and diagnostics while people are alive. But even contemporary studies in the U.S. show major errors detected in somewhere between, say, 8% and 24% of cases. Still pretty significant.
So why are these things missed? I mean, with all our modern tech.
Well, it's complex. Sometimes symptoms are subtle or they present in unusual ways. Clinical tests have limits, and autopsy allows for a direct, hands-on, full examination internally that you just can't do on a living person.
Right.
You get tissue samples, microscopic views, you see how all the organs are interacting or failing. It's a level of detail that even sophisticated scans sometimes can't provide.
And the sources mentioned something about death certificates, too.
Yes, a meta-analysis suggested about a third of death certificates might have inaccuracies, and that half of autopsies turn up findings that were completely unsuspected before. Half.
Wow. So these aren't just trivial details being missed. What kind of serious conditions are we talking about?
Oh, significant ones. One study looked at nearly 700 autopsies and found 171 misdiagnoses. Things like cancers, strokes, heart attacks, blood clots in the lungs, infections of the heart lining. Serious conditions.
And sometimes these can only be found this way.
Exactly. The sources say over a fifth of unexpected findings can only be diagnosed histologically, meaning looking at the tissue itself under a microscope from a biopsy or autopsy, and about a quarter of those are major issues.
So it's not just academic. Finding these things, it could flag medical errors, maybe previously unnoticed infectious diseases that could affect others. It feeds back into care for the living.
Absolutely. It's a crucial quality control mechanism in a
Yeah.
way, which also ties into why legal autopsies are sometimes required without family consent.
Right, if it's under legal authority, like a medical examiner or coroner.
Yes, particularly in sudden unexpected deaths where a doctor can't sign the death certificate, or if there's any suspicion of unnatural causes, foul play, accident, suicide. They're looking for specific evidence, wounds, poisons.
It's important to mention, though, isn't it, that some religions, like Judaism and Islam, generally discourage autopsies out of respect for the body.
That's a very important point, yes. Cultural and religious beliefs definitely play a role in whether or not an autopsy is performed, especially the clinical or academic ones that require consent.
Okay, so there are different reasons why they're done. Are there different types of autopsies as well?
There are. Our sources generally break them down into four main types. You've got the medico-legal or forensic one, the clinical or pathological, the anatomical or academic, and then the newer virtual autopsy.
Let's start with forensic. That sounds like the crime show version.
Uh-huh. Well, yes and no. Its main job is finding the cause, mode, manner of death, and identifying the person, especially in violent, suspicious, or unexplained deaths.
So what specifically is a medical examiner looking for beyond just, say, a bullet wound?
They're trying to piece together the whole story. Estimating time of death is crucial, looking for signs of struggle. And toxicology is huge, testing blood, urine, stomach contents for drugs, alcohol, poisons.
Stomach contents. Really?
Oh, yes. What someone ate and how digested it is can give clues about timing. But interpreting toxicology after death is tricky because body chemistry changes. It takes real expertise.
Okay. Then the clinical autopsy.
This one's more about understanding the disease process. Why did this patient die? What factors contributed? It's also used by hospitals to check their own standards of care.
And these have led to big discoveries.
Absolutely. Things like fetal alcohol syndrome, Legionnaire's disease, even viral hepatitis were better understood or discovered through clinical autopsies. They really advance medical knowledge.
But the key difference is consent, right? You mentioned the UK example.
Exactly. Unlike forensic ones, clinical autopsies generally require consent from the next of kin. It's about learning, not legal necessity.
Then there's the academic one. For students.
Yes, performed by anatomy students as part of their training. It gives them invaluable hands-on experience with real human anatomy and pathology. Seeing disease firsthand is very different from textbook diagrams.
I can imagine. It must really cement their understanding and develop those careful dissection skills they'll need later.
It really does. It's foundational for developing a good eye for pathology.
And finally, the virtual autopsy. That sounds futuristic.
It kind of is. It uses medical imaging, mostly MRI and CT scans, to examine the body without dissection. Creates detailed 3D images.
What are the advantages there?
Well, it's non-invasive, obviously. Good for identification purposes, maybe in mass disasters.
Yeah.
And it avoids exposing examiners to potentially infectious agents. It's a valuable tool, though it might not capture everything a traditional autopsy can, especially at the microscopic level.
Okay, so we have the why and the types. Let's walk through the actual process. What happens step by step? It starts when the body arrives, I assume.
Right. The body arrives, usually in a clean body bag or on an evidence sheet. Proper handling is crucial from the start.
New bag for everybody.
Always, to prevent any evidence mix-up. And if there's suspicion about evidence on the hands, maybe under the fingernails, they'll put paper bags over the hands and tape them shut right away.
Then the examination starts. External first.
Yes. First, photos. Lots of photos. Documenting clothing, how it's positioned, then collecting any external trace evidence, fibers, paint chips, residue. They might use UV light.
For things you can't normally see.
Exactly. Then hair samples, nail clippings are taken. Sometimes x-rays are done at this stage. After all that, the body is cleaned, weighed, and measured.
And a description is made.
A very detailed one. Ethnic group, sex, estimated age, hair color, eye color, any scars, tattoos, birthmarks. Everything is noted, usually dictated into a recorder or onto a form.
And sometimes that's it, just the external look.
In some places, yes. We mentioned the view and grant idea. If the medical history and circumstances are very clear and there's no suspicion, an external exam might suffice. Places like Scotland, Germany, Canada sometimes use this.
But usually there's an internal exam. How does that begin?
Typically, a support block, often rubber or plastic, is placed under the shoulders. This arches the back and extends the neck, making the chest more prominent and easier to access.
And the incision. People probably imagine a big Y shape.
That's common, yes. A deep Y-shaped incision from the shoulders down to the pubic bone. But other types are used too. A curved one across the chest, A single vertical line, sometimes a U shape, especially if only the chest needs examining or for cosmetic reasons on women.
The key is making it so it won't be visible later, right?
Absolutely. Respect for the deceased is paramount. Incisions are planned so they can be closed neatly and won't be seen when the body is dressed. And since the heart isn't beating, there's not really much bleeding during the procedure.
So once the incision is made,
The skin and muscle are pulled back. Then, special shears, like rib cutters, are used to cut through the ribs near the cartilage. This allows the pathologist to lift off the chest plate, the sternum, and attached ribs, exposing the heart and lungs sitting there in situ.
they look at them in place first.
Yes, to see the relationships between organs. Then they start the removal. There are different methods, sometimes removing organs one by one, sometimes in connected blocks.
Like that en masse or en bloc technique.
Exactly. The Latoul technique is en masse, removing everything together. Doan's technique is en bloc, taking them out in related groups. A modified Gone is pretty common in the UK. For infants, it's almost always en bloc.
So they'd open the sac around the heart.
Open the pericardial sac, yes. Look at the heart surface. They might draw blood from the heart chambers for toxicology or chemistry tests, then open the main lung artery, the pulmonary artery, looking for blood clots, pulmonary emboli.
And then take the heart and lungs out.
Right. They're weighed, examined closely, dissected further. Same for the abdominal organs, liver, spleen, kidneys, stomach, intestines. Removed, weighed, examined, sampled.
You mentioned stomach contents earlier for timing.
Yes, the stage of digestion can give clues about the time of the last meal, which might help estimate the time of death. Very important in forensic cases.
What about the brain? That seems tricky.
It requires a different approach. An incision is made across the scalp, usually ear to ear over the top of the head. The scalp is then pulled forward and backward, exposing the skull cap.
And they use a saw.
A specialized oscillating saw, yes. It's designed to cut bone, but not soft tissue, making it safer. They cut around the skull cap, then gently pry it off.
Revealing the brain underneath.
Exactly. The brain's coverings, the meninges are examined, then the connections at the base of the brain spinal cord, cranial nerves, blood vessels are carefully cut, and the brain is lifted out.
And sometimes it's preserved.
Often, yes. If detailed examination is needed, especially for subtle neurological conditions, the brain is placed in formalin, a preservative solution, for several weeks. This firms it up, making it much easier to handle and slice very thinly for examination without distorting the structure.
Okay, so after all the organs are examined and sampled, the body needs to be put back together. Reconstitution, right?
Yes, and this is done very carefully, especially if the family plans to view the body. The aim is to make the person look as natural as possible.
How do they do that?
The chest cavity is usually lined with absorbent material like cotton wool. The organs, after examination, are typically placed in a plastic bag, and that bag is put back into the body cavity.
Oh, they go back inside.
Usually, yes. Then the chest flaps are sewn back together neatly, the skull cap is put back in place, often secured, and the scalp is sewn back.
And the sources say it's often not noticeable afterwards.
Especially after the work of a skilled funeral director and embalmer, yes. The incisions are usually hidden by clothing. It's done with a lot of respect.
And there are rules about keeping organs.
Yes, certainly in the UK, for example. The Human Tissue Act 2004 is very strict. Organs and tissues must be returned to the body unless the family gives very specific permission for them to be retained, usually for more detailed investigation or research.
It's clear how important these procedures are, which makes it surprising to hear that rates are actually declining.
They are, quite significantly in many places. We saw the figures for England and Wales, 22.5% of deaths had postmortems in 2004. But by 2013, only 0.7% of hospital deaths had consented clinical autopsies in the UK. That's a huge drop.
In Germany, below 5%, compared to 20–30% in Scandinavia.
Right. There are concerns about underfunding and maybe just not prioritizing it. Even in the U.S., rates fell quite a bit in the 80s, from 17% down to under 12%, though it varies a lot locally.
Why do you think that is? What's driving the decline?
Well, our sources suggest a few things. Cost is one factor. They aren't cheap. And reimbursement isn't always guaranteed. Maybe increased confidence, right or wrong, in clinical diagnostic tools like MRI and CT scans makes some feel they're less necessary.
Even though we just heard how much they can uncover that scans miss.
Exactly. There might also be cultural shifts, perhaps less willingness to consent, and the religious objections we mentioned play a part too.
And critics are worried about this decline.
Very worried. Pathologists like George Lundberg have argued strongly that this reduction directly harms the quality of hospital care. If mistakes leading to death aren't identified through autopsy, the same mistakes can happen again. Lessons aren't learned.
So impacts medical education, safety protocols, overall understanding, a real potential blind spot.
Definitely. It's a loss of crucial feedback for the entire medical system.
Which makes you appreciate the long history here. This isn't some new invention. Where does the story of autopsy begin?
Way back, you can look to the ancient Egyptians around 3000 BCE. They removed and examined organs, though primarily for mummification, not really diagnosis in our sense.
But the idea of opening a body to find cause of death is ancient too.
Attested as early as the 3rd millennium BCE, yeah. Even though many cultures strongly opposed it, fearing desecration. We know of Greek physicians in Alexandria, like Erastides and Herophilus, doing autopsies in the 3rd century BCE, but it was rare in Greece overall.
And the famous case of Julius Caesar, 44 BCE.
Right. An official autopsy report stated that of his 23 stab wounds, only the second one was fatal. That's quite specific for the time. And by about 150 BCE, Roman law actually had guidelines for autopsies.
And Galen, the great Roman physician.
His anatomical work, based largely on animal dissection but some human observation, was the standard for over 1,000 years, well into the medieval period.
What happened during the Middle Ages and Renaissance?
Well, Arab physicians like Avenzoar and Ibn al-Nafis continued some work. There's even a philosophical novel by Ibn Tufayl, Hey Ibn Yaqzan, that seems to support autopsy for gaining knowledge.
And in Europe?
Dissection became more common from around 1200 onwards. They were even trying to preserve bodies using things like wax. Then you get major figures like Andreas Vesalius in 1543. He did a famous public dissection, and the anatomical preparation from it still exists, the oldest one in the world.
Incredible. And Morgagni.
Giovanni Battista Morgagni, active in the late 17th and early 18th centuries. He's really considered the father of modern anatomical pathology. His book from 1769 was the first truly systematic work correlating clinical symptoms with autopsy findings. A huge step.
So when did it become more standardized, like the procedure we know today?
That really took off in the mid-1800s. Karl von Rokitansky in Vienna performed an enormous number of autopsies, trying to link them back to clinical diagnosis.
Yeah.
But it was Rudolf Virchow in Germany who really pushed for standardization.
Why was that needed?
There was no consistency. Virchow developed specific methodical protocols for performing autopsies, and, importantly, he developed the concept of cellular pathology, understanding disease at the cellular level, often revealed through autopsy. He brought scientific rigor.
And linking it to the legal side, Scotland Yard.
Yes, around the turn of the 20th century, they established the Office of the Forensic Pathologist. This formalized the role of the expert medical examiner in investigating unnatural deaths for the legal system.
It's quite a journey from ancient Egypt to modern forensic science.
It really is.
Yeah.
And as we've sort of unpacked today, the autopsy is so much more than just determining how someone died. It's been fundamental to our understanding of disease, anatomy, physiology. It informs the living.
Absolutely. It corrects errors, uncovers hidden conditions, drives medical progress. It's this vital feedback loop.
Yeah.
So thinking about everything we've discussed, the critical insights autopsies offer, especially regarding misdiagnoses, and set against this backdrop of declining rates, it leaves us with a pretty significant thought, doesn't it? In an era where we're doing fewer and fewer of these deep post-mortem examinations, what crucial knowledge about human health, about disease, might we be systematically overlooking? And how could that gap in our understanding, perhaps subtly but significantly, impact the future health and treatment of all of us, the living patients?
That's definitely something to mull over.